Good morning, and welcome to the Johns Hopkins briefing. Today we'll be focusing on the crisis in the Middle East and humanitarian health. My name is Lainie Rutkow. I am Vice Provost for Interdisciplinary Initiatives at Johns Hopkins University. I'm also a professor in the Bloomberg School of Public Health and the School of Advanced International Studies. I'll be moderating today's briefing. I'm joined today by two of my colleagues from Johns Hopkins. Paul Spiegel is director of the Johns Hopkins Center for Humanitarian Health and a distinguished professor of the practice at the Johns Hopkins Bloomberg School of Public Health. Dr. Spiegel previously served as deputy director and chief of public health at the United Nations High Commissioner for Refugees. Len Rubenstein is a distinguished professor of the practice at the Bloomberg School of Public Health and interim director of the Center for Public Health and Human Rights. Professor Rubenstein previously served as executive director and then president of Physicians for Human Rights. I want to remind our audience that we will be providing answers to your questions in real time today. So please submit questions for our experts in the box that you see at the bottom of your screen. I'll now ask each of our panelists for their brief initial thoughts, and then we'll quickly move to Q&A. Paul, first to you. How is public health impacted by a humanitarian crisis, such as the current one unfolding in Gaza?
Thank you, Lainie, and good morning and evening, everyone. The public health situation is incredibly serious, not just in Gaza, in everyone on all sides affected. And I'd like to start first, actually, in something that we don't always start with, which is mental health. And the mental health of Gazan civilians, of Israelis who have been affected, of the hostages are extremely, the extremely high, and the care that they're going to be needing is going to be extremely important. And this just compounds, given the situation and given the intensity of the situation. Focusing on Gaza specifically, there are some unique aspects in Gaza that is going on. Number one is the intensity of the bombardment. Number two is that there is no escape valve, as we say. In many situations, people are able to move outside of a territory like Gaza and then receive protection and have access to care. That's not the case here. There is no escape valve. People are there. They're being pushed to move towards the south, but at the same time, less than 50% of hospitals now are functioning. Water is a major problem. And so the public health concerns are multifold amongst these groups. You have a very dense population, which can increase disease transmission. People are being displaced, and there does not appear to be a safe or protective area for them. So what are some of the public health concerns beyond mental health? Certainly trauma, and we're seeing a massive amount of trauma. We've seen over 11,000 people being killed thus far in Gaza, and over 27,000 that are injured. We're very concerned about infectious disease outbreaks. There are already reports of increases in respiratory tract infections, acute watery diarrhea, and we're concerned about cholera. As well as scabies. Another area beyond that we're very concerned about is continuity of care. So our people who have non-communicable diseases, whether they be insulin for diabetes, they need renal dialysis, they need cardiac medications. Are they able to receive such medications? At this point, the answer is mostly no, since many of the primary health facilities run by UNRWA are no longer functioning. And then finally, and as importantly, are maternal child health issues. You have many pregnant women. Many of these pregnant women, or a proportion of them, are going to be needing surgical care of some sort, high-risk pregnancies. Many are not able to get such care. And I'll end by saying, just looking at the time, is there needs to be alternatives to be able to make sure that people that are in need are able to get such health care. Right, whether that be through allowing more medications, allowing fuel, allowing water to be able to come in, whether there be ceasefire or humanitarian pauses. But our focus is on the humanitarian situation, the public health needs of the population, and what is happening in Gaza right now is extreme. I'll stop there. Thank you.
Thanks very much, Paul. Len, I'll turn to you. What is humanitarian law and how does it relate to health?
A humanitarian law, thank you, Lainie, and thanks for having me today. Humanitarian law is the law relating to conduct in war, and it imposes specific obligations with one major purpose in mind: to protect civilians, civilian objects and structures, and particularly healthcare in war. And it has some very, very specific requirements. Number one, you cannot attack civilians. You cannot launch attacks that don't discriminate between civilians and military targets. You can, if a civilian object is used for military purposes, the attacker has to take specific precautions in the means and methods of warfare to minimize harm to civilians. In addition, civilian utilities and the means of life, like electricity and fuel, cannot be attacked. And humanitarian aid in war must be facilitated so people can survive. Those are some of the major rules. There's another rule called proportionality, which is a little complicated because it says that you're balancing excessive harm to civilians in an attack, even if it's a military object, and the importance of the object in military strategy. So you balance this. If the harm is excessive in relation to the importance of the military objective, it's disproportional. So that's a very brief overview of what the law is.
Thanks very much, Len. I'm now going to move to Q&A. I want to thank those who have already submitted questions. I do see your questions coming in, and we will get through as many as we can in the next 20 minutes or so. Paul, I'm going to send the first question to you. So the title of this briefing concerns humanitarian health. How do you determine that something is a humanitarian emergency?
That's a good question. And in simple terms, a humanitarian emergency is when a system itself, let's say the health system in Gaza, is not able to take care of the situation on its own and it needs support from outside. That's one area. Another, that's one criteria, so that there needs support from outside of the either territory or country. And another one is when you have a doubling of the baseline of deaths, another older indicator that we've used. And in any situation right now, it's clear that that Gaza and the situation is a humanitarian emergency.
Thanks, Paul. Len, I want to pick up on something that you raised during your opening remarks. Can you speak more about the bodies that monitor or report on compliance with humanitarian law?
There is no official monitoring body for humanitarian law violations. UN human rights agencies, such as the High Commissioner for Human Rights, do report on these violations, as well as violations of human rights law, which has to do with the way governments treat their own people. Many NGOs monitor human rights violations and humanitarian law violations. The International Committee of the Red Cross has a special role in speaking confidentially to all the parties to a conflict to seek their compliance, especially when there's evidence that they find that there is non-compliance. That is how the monitoring goes. But I should also add that both the World Health Organization and Insecurity Insight, an NGO, monitor attacks on healthcare in conflict. And they report how many attacks there have been. They don't make legal determinations whether there has been a breach of the law, but just to give you a scale of the problem in Gaza, the WHO has reported 137 attacks on healthcare in the last 5 weeks in Gaza. And 16 people have been killed, health workers have been killed, and many more injured.
If I can just add on to that, Lainie, the numbers, there have been more deaths amongst UNRWA, the UN Works and Relief Agency, over, I believe it's now 100 UNRWA humanitarian workers have been killed, which is the largest number of UN workers being killed in such a short period of time.
And Paul and Len, a follow-up question to what you were both just saying, during a humanitarian emergency, what typically would you see as protections for healthcare workers or for UN workers on the ground?
The protections, the fundamental protections, are the responsibility of the combatants. And that responsibility is to ensure they're complying with the law. And we unfortunately have a lot of evidence in this conflict that there is no compliance. And in fact, I think law itself could be a casualty of this war, in the sense that certainly Hamas has murdered civilians. It sends rockets indiscriminately into Israel. It has taken hostages, and there is evidence that it uses civilian structures for its military purposes. On the Israeli side, there are concerns that Israel has not taken steps to minimize harm to civilians, including in hospitals, including hospital patients. There is evidence, too, that it does not properly apply the proportionality requirement, and has essentially claimed, at least implicitly, that their military objectives and the existential threat posed by Hamas means they have to reach every commander, every tunnel, every commanding operation that will outweigh any harm to civilians. So there are other issues as well concerning the cutoff of electricity and fuel in Gaza, and which could be seen as collective punishment, which I neglected to mention before, and the fact that people who are required to leave an area of combat are not assured of shelter, food, water, as the law requires. So it's a very, very disastrous situation, both from a humanitarian standpoint and from the point of view of the purpose of international humanitarian law.
Thanks, Len. Paul, did you want to jump in on this one?
I would just say, from an operational point of view, in Gaza right now, it's lacking what we call humanitarian space, the space to allow humanitarian workers to work in a protected environment to do their job. It isn't there right now, and therefore it's making, despite all of the limitations, it's making it extremely difficult for humanitarian workers to carry out the functions that are needed, even if they did have, which they do not, sufficient supplies in terms of water, shelter, and fuel and medications.
Thank you. I want to shift. We have several questions coming in about inaccurate information or just misinformation. And I'm asking this of both of you. Len, I'll send it to you first. So one of the things that's most challenging for the public is knowing where or how to get accurate information about a humanitarian emergency. What advice do you have?
I think we have to look for the best sources we can, certainly not social media. But even with those official sources, it's often very difficult to get good information. Both sides put out information, they put out videos, they put out claims, and there is almost no way of verifying those claims. Another issue is that the Ministry of Health in Gaza is controlled by Hamas. It has a reputation and has had a reputation in the past among UN agencies that it provides reliable information, and there's never really been a claim that it's inaccurate. On the other hand, Israel is claiming that it is putting out false information, and we have no way of verifying this. What I can say is there is sufficient information from independent reporting of the news media that very serious harms are taking place. Many thousands of people, civilians, are getting killed. And if we don't know the exact number, we still have that information. But I think that it is difficult to confirm, but we have enough information to be able to make some judgments about what's going on.
Thanks, Len. And Paul, same question to you.
Yeah. I would add simply that it's important to be able to look at the information and triangulate it from various sides, recognizing the biases from each side. In some situations there may be some groups that want to minimize or increase the amounts of either deaths or other things that they're reporting. But I'd also add what Len was hinting at. The exact numbers are not always the most important thing. It's actually looking at trends, and it really doesn't make, in terms of the response, if it is 10,000 or 12,000 people that have been killed at this point, the numbers are so large and so severe at this point that it shouldn't make a difference in terms of the response and the acuity of the response that is needed.
Thanks, Paul. And I have a follow-up question that just came in for you on that point. How do you yourself, as an expert, one who's been on the ground in many humanitarian emergencies, make sense of information as it comes in during a crisis?
Firstly, it depends on the source, and so yes, we don't go towards social media per se. What the information, for example, that I'm getting now is mostly from the UN agencies and some different governments. And as I said, what I do is I look at what is coming in. I look to see how the trends are changing, and then I look at the differences, and if there are contradictions between the two, and then try to understand. Also, we always look, and if you look at, for example, the numbers of deaths in Gaza right now, it's not just the total number, but it's always important to disaggregate by sex and then age. And there is a disproportionate amount of children, for example, being killed right now. Normally, in these situations in conflict, when we saw in Kosovo and other areas, when there are two groups fighting, usually it is men of military age that are often the highest numbers who are dying from trauma. This is not the case here, which also shows that there is a major problem that civilians are being disproportionately caught up in the number of deaths. And so all of that is looked at. And then I do take many numbers, because I've been doing this for a long time, with some skepticism. And the key is multiple sources, triangulate, and try to understand all of the biases.
Thanks. This is a question. I'm going to send it to both of you, Len. I'll send it to you first. We've been talking about Gaza, but we do have questions coming in. If you could speak to destabilization within Israel following Hamas's attack on October 7th, for example, through internal displacement or broader impacts. Paul, you spoke earlier about mental health. Len, to you first, and then Paul, please jump in.
Yes, we shouldn't underestimate the impact of the slaughter of civilians in southern Israel on the country. There are about 150,000 people from southern Israel near Gaza who have been displaced, including towns, 35,000 people who have been having to be evacuated from the town. There are also perhaps as many as 50,000 people near the Lebanon border that are displaced from their homes. There has been an enormous amount of psychological trauma in the country because it's a very small country, and the horror of what happened on October 7th is reverberating across the country, and everybody knows somebody who knows somebody, not many degrees of separation. And the prospect of people going back to their homes is incredibly uncertain at this point. Now, it's difficult to compare what's happening in Israel to what's happening in Gaza. But you asked about Israel. Yes, Israel has suffered and continues to suffer, and its population has from the October 7th attacks.
Thanks, Len. And Paul, please jump in.
Yeah, thank you. I'm glad that we are discussing that, because one doesn't want to compare. It doesn't make a difference in many ways. When someone is suffering, and sometimes the numbers can be distracting. So what happened in Israel was an incredible shock to the society. There have been, as Len was saying, both on the Israeli-Lebanon border, as well as in the southern Gaza border, there have been huge numbers of people that have been displaced. Furthermore, the number of hostages, the kidnappings, over 240 people, the psychological toll that has in a very, very small country is enormous. And then there is the trauma itself with over 1,200 people murdered by Hamas. There's also going to be there is injured. There's going to be rehabilitation. So the suffering amongst the Israelis is immense as well. And while the situations are different, and right now the focus is on Gaza for perhaps understandable reasons, we also must need to take into account very much what is happening in Israel and understand the trauma and also the echoes from World War II and the Holocaust that this has brought up. And finally, I would just add that the reverberations of this crisis are being felt often throughout the world, and the increasing amounts of anti-Semitism as well as Islamophobia emanate from this crisis. And I think that adds a whole other component of psychological and distress and fear amongst Israelis and Jews worldwide.
Thanks, Paul, and thank you, Len. Paul, a question for you, and this gets back to information. How accurate was information about health in Gaza, particularly morbidity and mortality, prior to October 7th?
Yeah. I've done some work with colleagues in Gaza, and so the information is strong, but it was in different silos. For example, UNRWA, the UN Works Relief Agency, has information on primary health care. That information does not always talk to the information from hospitals and others who are running in different systems. So it's siloed, but it was relatively strong in terms of, and robust in terms of the data that we do have or did have. And it also has helped, and this is actually something really important, is in many situations we don't have very good baseline data. So it makes it very difficult to know how many pregnant women there may be. In this case, it's 50,000, how many people on renal dialysis or cancer care. We do know that, which makes it very, very helpful as we're trying to ensure some sort of continuity of care, which is extremely difficult to do in this situation.
Thanks, Paul. And as we close in on 11:30, I want to ask you each for just a minute or two of final thoughts, anything that we didn't manage to cover in the Q&A, and then we'll wrap up. So Len, why don't I start with you, and then Paul, you'll get the last word. Len, to you first.
Sure. One of my concerns is, as I mentioned before, that law is becoming a casualty. And we have seen in the justifications Israel has set out through its spokespeople, whether military or civilian, that tend to justify attacks on grounds that differ from those in the Geneva Conventions. That it has said that when it conducts an attack, it warned people to leave, and if they didn't leave, well, essentially that they're not responsible, which is not the standard that should be applied. And I think I'm very concerned. We have to wait until we get the evidence of how targeting was done. But there are concerns about a concept that in a combatant's mind, a just war justifies or warrants many civilian deaths. And I think that without considering minimization and proportionality requirements, I'm concerned whether that is going on in this conflict. And we need to look at that in the days ahead.
Thanks, Len. And Paul, you get the last word.
Okay, thank you. Two concerns among many more, but I'd like to stress. One is the attacks on healthcare workers and humanitarian workers in healthcare centers. This was not occurring many decades ago, but it's becoming more and more common, and that needs to change because civilians, wounded combatants all need support and health care. And what we're seeing is, sadly, this is now becoming commonplace, that hospitals and health centers are being targeted. The second point is that I'm afraid we haven't seen all of the mortality yet that is to come, because most conflicts, the indirect causes, those not directly by trauma, but all of the indirect of exacerbation of existing illnesses, epidemics, and I'm very concerned over the next few weeks we're going to see a significant increasing number of deaths due to these indirect causes.
Thanks, Paul. And with that, I'll wrap up. I'd like to thank Paul Spiegel and Len Rubenstein for joining me today. I'd also like to give a big thank you to everyone who attended this briefing, and especially to those who submitted questions for our experts. A recording of this event will be made available on this website. Today's panelists, together with faculty from across Johns Hopkins, will continue to work on issues that impact all of our futures. Thank you again for joining us.
Thank you.